This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. What a beautiful day outside. Just, I almost stayed in my garden today. Didn't want to come into the studio, but then I realized that you're more important than the flowers. Give me a call, 888-630-9625, 888-630-9625. Love to talk to you on any subject that you have in mind. We have one, and one that affects thousands and thousands of people from time to time. It's one that if you go to your doctor's office, traditional medical care, they're going to either inject you or give you medication, and at some point they're going to say it's time for surgery. Well, this is a condition that is multidimensional, multifaceted, and it's the topic of our in-house continuing education program this Wednesday evening at 7:30 p.m. at the Roselle Center for Healing. This month is going by so quickly. Dr. Matt, this Wednesday, June the 11th,
June, right? It's June. Crazy, huh?
Yeah, I'm just sitting here. I was about to talk about the date, and I'm saying, oh, my God, it's almost over already. It's craziness. The 11th is Wednesday, and where's the time gone? It's insane. Anyway, Dr. Matt Adams, my guest in studio, your host this Wednesday evening. He's going to be talking about sciatic pain, leg pain. And sciatica is a term of description that is given to pain that runs down your leg, but it's not specific because the sciatic nerve really is not one nerve. It's 5 nerves. And they come off of different segments of the spine and goes to a place where they come together as a bundle about the size of your thumb, comes out right over a muscle or sometimes through the muscle in an anatomical change at the piriformis muscle. And then based on where the leg pain is, you have certain characteristics. And Dr. Matt, I want to get into that because there's so many people that suffer needlessly or on medications that are so powerful that the side effects are worse than the condition, and it never goes away. And then people end up with all kinds of things from nerve blocks to surgical intervention and so forth. Let's start with something simple.
Okay, simple.
Talk to us a little bit about what, from a standard definition, what is sciatica, what is it not?
Sciatica is you kind of gave a pretty good explanation of the nerve pain going down the leg. It's usually down the back and kind of to the side of the leg, and it's usually one-sided. That's the funny thing. I get patients often come in and say, "Well, I've got sciatica," and I'm expecting them to have pain at a certain spot, and they're like, "Well, no, it's right here on the front of my leg." Or it's right up here on my back. I'm like, well,
that's not sciatica.
Yeah, no, it has to go farther down, generally past the knee. If it's not going past the knee, there can be other things. But that's the funny thing about sciatica. It's not necessarily a diagnosis of a particular thing. It's a term that was given to explain pain going down the leg, and so everybody, even the medical field, just kind of uses it as back pain.
The general presentation is people between ages 30 to 50 years old, and it's something that can come on very slowly or something that can come on very spontaneously, very, very quickly. So what we need to understand about sciatica, as you said, that it's behind the leg, slightly to the outside. It can go all the way down into the calf. It can go into the foot. The distribution of the nerves are critical in understanding what segment it's coming from, whether it's coming from the 4th, 5th disc area in the back or the L5 disc area or part of the sacral nerves. Now, let's talk a little bit about this hot, searing, burning, sometimes numb, sometimes just... And when I talk about numbness, I'm talking about you can't feel... It feels like the dentist gave you a shot of Novocaine and you can't feel your lip. That's the kind of numbness that we're talking about. The diabetic neuropathy that people talk about, where there's pins and needles types of sensation in the foot, that type of pain also is consistent with sciatica.
You can get all of those because the nerve bundle, that's got nerves for sensation, for the skin, for the muscle, for moving your muscle, for motor. So all those things that your leg needs to do to send signal back to your brain, it's all affected. And so when you get irritation to that giant bundle, you don't necessarily know which part of the nerve is getting irritated. It can affect all those. So that's what makes it, people kind of get confused there, because sometimes it feels like you just need to stretch your leg all the time. Like I've had this before. When I was in college, it started off slowly, like you said, as something that felt like it needed to be stretched all the time. Then it started getting worse, and then some pain. And then I was getting sharp pain all the way down to my little toe. And then I was getting this electric pain. So it's not fun. I've experienced it. I can sympathize with all those patients and all those people listening right now that are going, okay, I kind of get that. I sit in my car in traffic and my leg starts to hurt. I get kind of tingly in my leg. Yeah, that's what we're talking about right now.
Generally, there's positions of relief.
Yeah, usually for most people, like lay on your back, getting your knees up is a very relief position. Prolonged standing and sitting, those are usually the worst for people with sciatic pain. I mean, sitting, you look at the biomechanics, there's more pressure on your lower back in its seated position than any other position, even standing. And what do we do most of the time nowadays around here? We sit.
Yeah, we sit.
Yeah.
We sit in the car. We sit watching television. We become couch potatoes. We don't move. We get up and we wonder why we hurt. And it's not the sitting posture that we're talking about of the aggravation, but the sitting posture also can be the contributing cause of the problem as well. Let's talk about some of the causes, and we're going to get into, as we get into the program a little bit more, I want to get into some of the fixes. I want to talk about prevention, and this particular topic is one that is far-reaching because a lot of people don't understand the mechanisms behind it. We have patients that come in all the time that are treated so badly, they go through surgery, they still have the pain. When we talk about back and leg pain, those two things can be independent of each other, and it can be something that one is triggering the other. But right now we're talking about leg pain by itself. So let's take this thing apart. Let's talk about the nerve itself, where it comes from, what the problem is with that nerve, and why the pain. So we've got this big, long nerve that's going down the leg, and it's coming from the low back. And we said it's not really a nerve, it's 5 nerves.
Yeah.
And so what are some of the triggering mechanisms? What do you see in practice with, a lot of your patients that come in, and unfortunately, there's so many people that suffer from it, we see a lot of this type of condition.
Well, I mean, a lot of times it's, I bent over to wash my foot and in the shower, and all of a sudden my back went out, and now I got pain running down my leg. Or I went to pick up my sock. Most of the time it's not something major that they were doing. It's something a little small. And what that means is it's something internally that was building over time. So usually it's a chronic thing. I think the most common cause of it is a disc bulge or herniation putting pressure on there. And that's usually something that chronically you've been in a position, your disc has to kind of hold you in place, and now you're pushing on one side and it's shoving that disc out to the other side, and then eventually everything just gives. And you hit that nerve and you're in searing pain and you're like, I didn't even do anything. Why am I hurting? So that's what I usually see. It's not as often that I see, somebody tried to pick something really heavy up and then just threw everything out. It's usually something small. Doesn't mean that they did something like that before, injured themselves, and didn't realize it. But
it comes from the low back and it radiates in there. But the sciatic pain can be independent of low back pain. It doesn't have to be there consistent with it, and it doesn't have to come from a disc. I mean, and that's one of the things that people have to understand, that discogenic pain, slip disc, bulging disc, fragmented disc, protruded disc don't have to be the underlying triggering mechanism of this thing. This nerve comes out about the size of your thumb, as we talked about, through the sciatic notch. It's a opening that's made up in the pelvis. That's, if you're sitting on it right now, if you're listening to the program, and if you take your finger and you kind of touch the middle portion of your buttocks, and there's an area there that there's a lot of muscles that go through it, but that's where that nerve root comes out. And when you sit on that or you bump into it, if you have a true sciatica type of condition, it can do one of two things. It can either blunt the pain or it can light it up, one way or the other. So let's talk about that a little bit and the mechanisms of that, the underlying structures. You have muscles that are associated with it. You can have muscular imbalance and entrapment. That can tweak that nerve. You can have an inflammatory reaction of any of the nerves in your body, and if the nerve has already got a tug on it or a pull on it, you can have searing pain that you're really not understanding where it's coming from.
Oh yeah, you got your piriformis muscle right there. It's a muscle that makes your leg kind of rotate out. It's also a muscle, if you watch somebody walking and it looks like their pelvis is twisted to one side, I mean, it's a muscle that kind of keeps the pelvis stabilized. So that muscle can get real tight, and the nerve actually passes like right underneath it or sometimes through it. And so that's a real easy. It could be too tight or it could be overstretched. And either way, you're going to pinch down on that nerve. We call that piriformis syndrome. And that's hitting pressure right on that sciatic nerve right there. Like I said, there's irritation. You've got all these nerves coming from different holes, from the sacrum or your tailbone all the way up to your lower back. And so, yeah, if you've got something that's not in the right position and you're sitting on it all day, it's very simple to it doesn't take much pressure on a nerve to cause some problems. And you may start noticing some weakness in that leg first, or maybe you just start noticing a little pain down in your calf or something like that. Like you said, doesn't have to be your lower back that's causing it.
888-630-9625. That's 888-630-9625. Love to talk to you. We're talking about sciatic pain, but we'll entertain anything that you'd like to know about. This Wednesday evening, the 11th of June, Dr. Matt Adams will be your host, your presenter at the Roselle Center for Healing in Fairfax. We're just off the National Capital Beltway. He's going to be talking about this leg pain, this problem, this burning, this ridiculousness that so many of you are taking medications for, from anti-inflammatories to very strong things like oxycodone. It's not necessary. There is a resolution to this. You can get it fixed. You don't have to submit generally to surgery. Why do that when you can do it without? This is a situation where it can impair your life. It can make life miserable. You don't feel like doing anything. You can't walk. You're on medications all the time. Or, the absence of pain, the complete deviation is actually a noxious simulation. This pain is numbness. And it often will present itself and manifest itself just in the feet, at the end pieces of the nerve root, where it feels like a diabetic neuropathy. How often do you see that type of thing, Dr. Matt?
Oh, real often. I mean, this has been something that's been extremely common for years. And I think that we're going to see more of it, not because, of heavy labor using our back, but because of constant sitting. We're going to see it because of forward head posture. You talked about stretching. I mean, the nerves go all the way down. They can get overstretched because of the top. And so we've got to correct even stuff up top. So it's extremely common. I think most people that are listening to the show, or most people out there, because of driving, because of lifestyle, have some sort of back pain and have at some point felt something go down their leg or some kind of tingling, and they just assume, it'll go away. But it doesn't really go away. Something's not in the right position.
No,
so,
it's a predisposition to the things that are not good. It's a prodromal, not to be ignored. We're coming up to a break, and we're going to get into this much more in detail, and we're also going to take your phone calls. This Wednesday evening, Dr. Matt Adams will be your presenter at the Roselle Center for Healing. To do that, meaning to join his presentation, 703-698-7117. We'll be right back.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. My guest, Dr. Matthew Adams, will be your presenter, your host, this Wednesday, the 11th of June, 7:30 p.m. at the Roselle Center for Healing. He's going to be talking about sciatic pain. You know what that is? Pain in your leg, the behind your leg, a little bit off to the side. It hurts. It burns. It's ugly. It's nasty. It makes your life miserable. And some of you are on all kinds of medications to get rid of it. If you'd like to join us, try to find out what's going on with that leg pain that you have, that numbness, that burning that you have, all you need to do is call our office, 703-698-7117. That's 703-698-7117. Tell my staff you'd like to be there. These in-house programs are our gift to the community. They are free to you. All we require is a reservation and the fact that you show up. I mean, that's why we do them, is to educate you and to give you as much information as we possibly can. Let's go to the phones, and we'll get more into this information. George, how can I help you, sir?
I'm in on my experience with the sciatica. It's been about 6 years ago. I was diagnosed as sciatica, and the condition was a slight pain in my lower back lumbar region down through the right glute. And the insidious part was no pain during the night, but it would always at night wake me up. So he confirmed, my physician had diagnosed with an MRI that slight arthritis sitting at the base of my spine, recommended physical therapy, and is fortunately one on staff at the sports club gym I belong to, recommended a stretching exercise program, and also modified with my trainer my actual workout routine. Well, I addressed that and have been maintaining it ever since then, and the problem went away.
Yep. So what you're actually dealing with in that type of situation is piriformis syndrome. That's where that muscle actually is not balanced properly, and it's causing a torsion, a pull on that nerve, causing compression and causing the pain pattern. That arthritis that you have in your low back was not the cause. You know, that just happens to be there because you've been doing some wear and tear type of situation. Now, arthritic conditions are a prodromal of biochemistry and injury coming together in a perfect storm, causing changes and shifts in any joint space in the body. But just make sure that you're clear of that pain and it doesn't come back, and that there's no numbness and that you're not putting up with it. But I'm glad to hear that you got rid of it. It's totally based on what you told me. That's a piriformis syndrome, and those are the easiest to correct.
Well, that's the insidious part of it was no pain during the daytime, but awakened at night, and the pain as long as you was in bed trying to sleep. And
Sure. Well, that's easy to figure out, George, simply because of the fact when you're in bed at night, you're not moving the muscles, and you're locked into usually one pattern. When you're up and moving around, you have to use those muscles, so they have to fire them, so you compensate. So now you're laying flat, you're not compensating anymore, and the areas that are weak, the muscles that are not firing properly, are the ones that are going to start screaming, and if it happens to be over that nerve, that's the place that you're going to have the pain. That's why it happened. Anyway, I'm glad that it worked out for you. Thanks for calling in, Sharon. I appreciate it. Robert, thank you for calling, sir. How can I help you?
Yes, thanks for taking my call. I've been dealing with the sciatic pain for the past year, and what my question is discoloration common behind the knee on the side with the sciatic pain?
Discoloration is not a common thing with that. That's going to be more, a lot of times, something vascular. Sciatic pain, you'll feel numbness and you'll feel the sensation, But when you get into discoloration, that's getting into something a little more possibly serious with the discoloration there.
If it's a one-sided thing, at that point what you do is you have to measure the differences in the calf muscles. You have to look and see if any of the pulses, the arterial beating of the long extension, the arteries that go into the leg, have been compromised at all. But you'd have to look at them, and you check all the muscle strength. But discoloration in the knee itself is not consistent.
And see
with sciatica.
if it's getting bigger. I mean, just kind of pay attention to that, see if it's getting bigger. But that's definitely something you should probably check out.
Do you notice whether it's hot?
It doesn't really hurt or anything where the discoloration is, but the pain is coming all the way from my foot, the heel, up the leg, around the hamstring, and the discoloration. It looks like varicose. That tells you it's vascular. So you need to take a look at that, and you need to get to somebody who can treat that, particularly if it's significant. The pain that's coming from your heel all the way up is, and not from the butt all the way down, is probably something called a tarsal tunnel syndrome or a calcaneonavicular problem. And the calcaneo meaning your heel bone, the talus is the next bone forward, and they often get trapped, and they can cause a retro irritation of the nerve that's coming from your foot. So you treat the entire leg. You treat the joint spaces. You treat the different muscular patterns. You have to manipulate and adjust the foot and then support it, and then that goes away. We treat those all the time. Okay, Robert, thanks for calling. I appreciate it. We're coming up for a break. We're going to get into this much more in depth. There's many of you that are calling in. We have one question on cancer nutrition. We're going to cover that. We'll be right back.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-9625. My guest in studio, your host this Wednesday evening, the 11th of June at the Roselle Center for Healing, Dr. Matthew Adams. At 7:30 p.m., he's going to be doing a presentation on sciatica, leg pain, that awfulness that's in your leg that causes you to be miserable at night, walking around during the day. It changes relative to posture patterns. It can be numb. It could be burning. It could be throbbing. It could be aching. It could be dull. I mean, the characteristics are innumerable. Sometimes it's just isolated to your foot or your calf. Having said that, please be our guest. If you'd like to attend, we are about a quarter of a mile, maybe a little less, off the National Capital Beltway. We're in the Red Cross building on the corner of Prosperity and Route 50. All you need to do is call 703-698-7117. That's 703-698-7117, and ask my staff what the availability is. Now, we have limited space, so when that's done, it's done, but we'd love to have you. Dr. Matt will take his time and give you options and tell you what can be done and show you how to prevent this stuff and, more importantly, answer your individual questions. I want to remind you, October is coming up very rapidly, and so is Ageless Health 2014. This is a day to remember. This is a day that can reclaim your wellness for you and your family. This is our annual event. It starts in the morning, and it goes to 5 o'clock in the afternoon, and the presentations are amazing. Go to our website. Go to rosellecare.com, 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 and check it out. If you register before June is out, you'll save $40 per ticket. We lose money, you gain. You will have an organic lunch. We'll be doing all kinds of wonderful things. I promise you, you'll go home with more information than you can possibly imagine that will be immediately adaptable. This is tools that you can use to enhance and change your life. Check it out, rosellecare.com.
And have things to read it later, because you may not be able to remember everything that goes into your brain that day.
Yeah, you'll go home with all the data, all the information. We'll give you a thumb drive with all the information on. We'll give you notes there. This is an amazing day. And by the way, if you do attend, you'll be entered in a raffle for $1,000 of health care. So show up, be there. I promise you will not be disappointed. It's a day that can change your life and perhaps save your life as well. Dr. Matt, let's get back into the topic a little bit. But before we do, there's a lady that's been very patient, and I want to answer some of her questions. Gloria, thank you for sitting there and waiting so long. I appreciate your phone call. How can I help you?
Dr. Roselle, would you kindly comment on the role of nutrition and supplements in treating cancer.
Oh, wow.
When this question was raised last week to the oncologist, he casually responded that there perhaps might be a negative role that sugar in the diet may play. However, he underscored his comment with the implication that the evidence is anecdotal at best, studies aren't in, so politely we just don't even have to go in any direction.
Okay, so I'm gonna say two things to you, Gloria. I will touch on it right now. This is a subject that I will promise you I will get into in depth. I'm going to have Sue come in, and she and I will go back and forth for an hour. It's an important subject, and so let me start out with saying this very respectfully to this doctor. You better start doing your homework because you don't know from where you talk. It's one of those situations that there's a tremendous amount of information out there. The Institute of Functional Medicine has been around. These are brilliant medical, naturopathic, chiropractic physicians from around the globe that have the ability, cutting edge, to show you how the application of nutrition and nutritional supplementation is not anecdotal but primary in not only treating but preventing any type of cancer. So let me put it to you this way. Cancer loves sugar, all right? And just as an analogy, a relationship, they do something called a PET scan to pick up soft tissue cancers. Now, a PET scan is the injection of radioisotope sucrose, sugar, into the body. Why? Because cancer cells eat it up. And then they take a picture, CAT scan, and what they see is all the cancer cells light up and glow like crazy because they love the sugar. So if cancer didn't like sugar and grew on the sugar, then that technology wouldn't work, but they use it all the time as a standard. So if you put sugar into the body, you got a problem because you're feeding these guys. Now, sugar is also acidic, and cancer grows in an acidic environment. If you want to shift the environment, you've got to shift it alkaline. So that means you've got to get rid of the sugars. As much alkalinity as you can cause within the body, you have a greater healthy environment to be able to allow the body to heal itself. Cancers are cell tissues gone crazy, and there's underlying genetic pattern sometimes that's been irritated with, sometimes we call junk genetics, not in every situation, that now come to the forefront. We're seeing more and more of it with genetically modified foods and halogens that are in our different food products. A halogen is like a bromide that's been sprayed on your food, and virtually today anything that is not organic you can suspect that has a GMO modification to it. Again, a topic for an hour to 2 or 3, and it's one that we probably will get into later on. But nutrition is a huge supporting mechanism minimally, and in many situations primary. And I'll talk to this doctor or anybody else. I'll go and lecture to them and tell them why, and I'll give them song and verse. There's you can simply say go to the Institute of Functional Medicine, go to Joe Mercola's website, mercola.com. There's a lot of different, just on the surface, evidential areas that you can check things out. The Council on Clinical Nutrition, any of these things, the American Institute of Nutrition, all of these guys have tons of data. So having said that, I know that I could spend the rest of the program on it, but I can't do that today. They can write me. Any of you can write me. Go to drtomroselle.com, drtomroselle.com, and ask me whatever questions. I will send you data. I will give you reference sources. But for a physician to blatantly say that the evidence is anecdotal or it hasn't, there's no format or substantiation, doesn't read their own literature. Doesn't read their own literature. The British medical journals, the New England Journal of Medicine, they all are substantive. They all come out with articles indicating that you have to change nutrition, you have to change the dietary input to have a positive impact on cancer. Gloria, I hope that helps a little bit.
It certainly does, Dr. Roselle.
Thank you for calling.
And I will follow through. Thank you again.
You're welcome.
That was a short version, huh?
That was.
You have to take a little deep breath and calm down after that one.
That wasn't even a hair. That was no. That was like, let's talk about it. No, we can't do that. Denise, how can we help you? Thank you for calling.
I have 2 questions. I'm going to let my husband ask his question, but right now I want to know about cataracts and floaters and retinal detachment. My daughter had retinal detachment. I have floaters, and my brother had surgery for cataracts. but he has like a little veil over his eye. He says it bothers him worse. So is there any vitamin or anything that can be done for these 3 eye conditions?
Well, not across the board, but to maintain healthy eyes, you have to do several things. One, protect your eyes from the sun, wear sunglasses, and making sure you're filtering out all the nasty rays. Don't go outside in the summertime without sunglasses on. You're doing tremendous damage to your eyes. That's number one. Number two, cranial pressure, the imbalance of the movement of cerebral spinal fluid that's produced in the brain. If that's not moving the way it's supposed to, you're going to put tremendous pressure on the eye and develop things like glaucoma. Those cranial plates have to be balanced. The stabilization of the skull and the first 2 vertebrae are critical in the movement of spinal fluid motion, and also your skull's made up of 22 plates. They move as you breathe in and out, and you have to make sure that they're working in synchrony and they're not jammed and building back pressure like in a dam. So you have to do that. Nutritionally, things like lutein and beta-carotenes and vitamin E and vitamin C, those are necessary to maintain healthy eye integrity. Bilberry is another one. And if those things are in balance and your levels of oxidative stresses in foods are low, you want to stay away from the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, the junk, the GMO types of products. All those things are going to cause tissue degradation. Again, another topic that we can get into quite at length. We want to keep the inflammatory levels down, high levels of ascorbate, but again, each person is different. A floater simply is damage to the vessels of the eye. Most people have them. There's not a lot that you can do about them. If they're really big, you can. Some of the institutes, the eye institutes, are getting rid of them with laser application, but again, it depends on the individual person. I've got floaters. I've played football. I've wrestled. I've done martial arts. I've had multiple accidents. If I look against a clear wall and I move my head, I can see these things floating around. And, you adapt to most of that. Only when they become severe do you do something. But how do you protect those, and how do you make sure that, you don't continue breaking things down unless it's through trauma, is by doing the things that we talked about.
Have you heard of a vitamin called, or eye drops that are called carnosine?
Carnosine?
It's got NAC in it, N-acetylcysteine?
Yeah, N-acetylcysteine, carnosine, and so forth. Those are other nutrient bases that will help, but not one. There's usually a broad-based application of things. Again, with our patients, what we do, and when they come through the nutrition department and we're working that way, we check to see what their dietary patterns are to begin with, and then we supplement or we change dietary patterns accordingly. We make the recommendations that I'm making right now, and some other things. Again, depends on the patient. So I hope that helps a little bit.
Yeah, okay. Here's my husband. He had a question also.
All right, good.
Hi, doctor.
Sir.
Yeah, I'm 57 years old, and 10 years ago, and when I was younger, I loved to run. I used to run a lot. I was really in good shape, and then all of a sudden, one day I was running, and I started getting a pain from the back of my ankle to the calf muscle, like a real burning sensation, and then all the way to the calf, like I couldn't run for another 2 weeks till that healed, and then every time I try to do it again, it'd start coming back, and now that when I do run, I just run a little short ways, and then I quit because I feel the heat coming back to that pain. What could that be?
That sounds almost like you got an impingement of the nerve somewhere in the leg due to a muscle, like we talked about with the piriformis muscle, possibly farther down your leg. So when you start running, you're contracting that muscle. The muscle pattern is keeping it contracted to where it's causing pressure on the nerve into that area. That's one possibility that we'd have to evaluate. Number two, you start running, and if your particularly lower back area is not in a good place, now you're putting pounding on there, so you can be hitting the nerve up higher, and it can manifest itself lower. So now you're getting like a muscle cramp in there and a burning of the nerve going down to the calf. So there's two. Well, that's just two possible. Then you also got to look at the foot, where the foot is, and if the body's trying to mechanically support itself because the foot is and the knees are not in the right position. So now it's making up for that. So there's multiple angles you have to look at, but it really sounds like you have an impingement in the nerve somewhere in the leg, and as soon as you start running, it's cramping up on there. So we'd have to go through and figure out, and you can go in there, you have to release the muscle, you have to find out where the mechanism is, and fix it.
Now, if you have nerve root irritation as well, good to remember all those muscles in the foot and the leg and the calf are innervated by muscle or nerves that come from your low back. But you have to also look at the mechanics. In the lower leg, you have two bones. You have the tibia and you have the fibula. The fibula is a smaller bone. That bone has a tendency to deviate, and what happens is there's a nerve called the common peroneal nerve that is irritated. That'll go down into the calf and into the foot. You'll get a little bit of lateralization or foot drop on one side, putting torsion on that calf muscle. And the calf muscle, by the way, is two muscles. It's called the gastrocnemius, and then underneath it is a muscle called the soleus muscle. Now, they can either support each other or they can be irritations to each other. Depends on the torsion, the torque of the pedal base meaning your foot. So you have to look at all of that as it relates to why it's happening to begin with, and you start with the foot, you go to the knee, you go to the hip, you check the bones that we talked about, and you can see if you can find it. But there's no reason that pain should persist. You have to find out where it's coming from. You fix where it's coming from, and the pain goes away. I hope that helps you a little bit. If we can be of help, give us a call. Come to the class on Wednesday evening. We're more than happy to sit there and really talk to you about it specifically afterwards. Please be our guests. Appreciate you being there. The class this Wednesday evening, given by Dr. Matt Adams, my guest right now, is going to be on leg pain and all the things that happen to the leg. But you don't have to put up with it. You don't have to take the drugs. You don't have to deal with all the irritations that are there on a day-to-day basis that you're putting up with.
Fixing the problem.
You're not fixing the problem.
It can be fixed.
If you're taking an anti-inflammatory, if you're taking a muscle relaxer, if you're taking oxycodone, if you're taking any of these nasty, ugly drugs, no reason to do that. Join us, really. It's a beautiful night outside this Wednesday. It's going to be absolutely stunning, so go for a ride.
It won't be outside, though. It'll be inside.
Yeah, he doesn't go outside. No. He likes to talk inside.
We could try to set something up.
That might not be a bad idea. We can do a tent revival.
I would enjoy that outside.
It actually might not be a bad idea if we can attract a lot of people to do what we're doing. 703-698-7117, 703-698-7117. That's how you register for this Wednesday's presentation by Dr. Matt Adams on sciatic pain, leg pain, burning pain, numbness pain. If your foot's tingling and it's you got one side, you kind of tap your foot and it kind of vibrates a little bit and it's numb, and you say, that comes and goes. Well, coming and going isn't the thing that you want to put up with, because pretty soon it's going to be...
It's not going to go.
It's not going to go.
It's going to come and it's going to stay.
It's going to get worse. Yeah, and you think then your doctor can tell you, well, you have diabetic neuropathy. Not so much. Not so much, particularly if they can't prove it. That's not something you should put up with. But really, seriously, be our guest. We'd love to have you. And don't forget, coming up in October, the 18th, Saturday, Ageless Health 2014. Please be our guest. We'd love to have you there. It's going to be a day, I promise you you will not forget. And register before the month of June is out, and you will save $40 on your ticket. Go to our website, go to rosellecare.com, and then call 703-698-7117 to register for this Wednesday's class. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio every Sunday, 12 noon, bringing you the most intimate and updated information on integrative and alternative healthcare. We're here for you. That's why we do the program, out of a place of love, commitment, and service to you. 888-630-9625. That's how you find us here. And if you want to find us off the air, you call 703-698-7117. That's 703-698-7117. That's how you register for Dr. Matt Adams' presentation on leg pain, sciatica, numbness, all that nastiness that's going on for you. Please be our guest this Wednesday evening. We'd love to have you, 7:30 p.m., the 11th of June, and I promise you'll get a whole bunch of information that you didn't even think about before. But show up. We'd love to have you there as our guest. There's no cost, just a reservation is required. Give us a call. We're going to take one more call, and then I'm going to ask Dr. Matt to kind of wrap this up for us. So, John, thank you for calling. How can I help you?
Hello?
Yes, sir.
Yes, I have a question. I wanted to know, what is your opinion on what should I do about getting vaccinations? And also, I wanted to know, what is your opinion on, like, various cosmetic surgeries like Botox and other injections? Because I'm thinking about, I was going to get a tail installed and get a new ass cheek installed. And I wanted to know, what is your opinion on that?
Okay, so let me give you a couple real quick situations. Number one, Botox, never. It's a neurotoxin. It'll destroy your body. There's a lot of information that's coming out that we've been saying for years that can affect brain, can affect the nervous system. You don't want that in. It's a toxin, period. End of story. I wouldn't put it in my body. Even under the worst case scenario, it's not going to happen. So that's that goes without saying. The problem with any of these things is that you're doing something against what your body was designed to do, and your body was made gloriously, was made beautifully, and when you start messing with it, other than with natural sources, it's not a good thing. Dr. Matt, we only have a couple minutes. Let's wrap this up. Let's talk about what you're going to present this Wednesday evening. Let's talk about the different things that people can learn by showing up.
Yeah, so what I want to focus on this is not necessarily explaining what sciatica is, but we're going to explain all the different things that cause it and the things we don't think about. What is coming from? Is it coming from the back? Is it coming from the leg? Coming from the muscle? And we're going to talk about what we can do for it, what we can do to prevent it, and hopefully people can leave with an idea of, if they have a problem, what they've got, and some ideas of what they can do to help it feel better. And probably give a little bit of a personal history of myself, who has gone through it, and the struggle I had, and how I was able to overcome it as well. And so I think that through that, anybody that comes can really be uplifted, can get a better understanding of what their problem is, and take something home to help themselves and help other people. So it's going to be really, really good talk.
Sciatica is not one of those things that will rust up and go away. You really have to pay attention to it, because your body adapts to the pain pattern. It tells you that you've got to do some other things. We're coming up to the end of the program, as we do, unfortunately, every Sunday, and it's one of those things where I wish I had 3 hours to talk to you about your problems and all the intimacies that are out there in the integrative community. Someday we'll figure it out, and Dr. Tom Roselle will be syndicated, and we'll be all over the country, and you can ask me any question that you want. But until then, we have to do it once a week, and you get a hold of us by calling the Roselle Center for Healing. Do that as soon as you'd like to. See you next week. Our best to all of you. Bye.
Health.